Well, you've done it. You've completed the online pre-consultation. I hope these series of many videos has been super helpful for you in determining whether plastic surgery is the right option for you. Now, there are a lot of things that we can do to look younger or get the appearance that we're looking for. And plastic surgery, actual going to the operating room, should be your last resort for these things. And so, if after watching these videos you definitely want to make some changes, but you're not sure that surgery is the right way, then I encourage you, take a peek at my book, The Age Fix. That's going to give you an entire plethora, all your options of both surgical and non-surgical treatments to get you looking the way you want to look. But if after going through this online pre-consultation you want to take the next step towards plastic surgery, then we would go to a face-to-face consultation. And that's what this video is going to do for you, is explain what occurs then in the face-to-face consultation. So during the face-to-face consultation, that's when you come into the office and we will meet. We will begin by going over your past medical history. And so we'll have you fill out all the forms prior to coming in. We'll go over your past medical history, talk about what surgeries you may have had, what current illnesses that you may have, what you've had in the past. We'll also talk about what medications you may be on and the types of medications that you need to get off of. We'll also discuss what type of cosmetic issue that you have. And so this is when you get the chance to ask me all those things that you wanted to ask a plastic surgeon. So if you're thinking about breast surgery, you may ask me, okay, Dr. Yoon, I have got issues with how my breasts look. What can we do about it? And this is when you tell me all those things that you wanted to tell a plastic surgeon about things that bother you or about things that you want to change, okay? And so this is when you have your time to really discuss that with me. And I really look forward to hearing what you would like to change, what may bother you, and what I can hopefully do to help you out with that. We will follow this up with a physical examination. During the physical examination, we may take measurements depending on the part of the body that we're looking at. We may have you sit at our three-way mirror to take a peek at areas of the face that you may want to change. We also have a three-way mirror for the body to take a peek at other body issues that you may want to change as well. And this is hopefully going to be very, very educational for you, because you'll be able to see those changes that we talk about on these pre-consultation videos, but hopefully you can see on your own face or on your own body what we may be able to change. And then after doing the examination, we'll discuss the surgical recommendations. I'll go over the operations with you in detail, as well as the recovery, how that works, and the risks involved as well. And some of this information will be reviewed for you because you will have gotten it during these pre-consultation videos, but now we're going to really individualize it for you. Now, the next step after that is I will have you meet with my patient coordinator, and if you are a good candidate for surgery and if you want to proceed with considering surgery as an option, she can give you an accurate price quote for the procedure or procedures that you're considering. At that point, if you want, you can consider scheduling surgery for the future. But if you're not sure and you want to think about it, that is perfectly fine. The decision to make surgery, or the decision to have surgery, is completely up to you. And you will find no pressure from my office. There'll be really the decision to make surgery is something that you really need to make in a very planned and thoughtful manner. I don't want you at all to feel like you have to rush into having something done or feel as if you have any incentives to have it done early or anything like that. Really, because it's cosmetic plastic surgery, this is something that really is a very personal decision. And I want you to take whatever time you need to make that decision for yourself. And you know what? Maybe that decision after meeting with me is, I don't want to have surgery. Maybe it's not right for you. If that's the case, that's perfectly fine. It's not right for everybody. And you need to make whatever decision you feel is in your best interests. Now, just for your knowledge and for your planning purposes, the time that we spend in a face-to-face consultation, you and I, is going to range anywhere from about 20 to 40 minutes, okay? And that depends on just how many procedures that we discuss at that time. The entire time of your consultation that you're in the office can range anywhere from 45 to 60 minutes or so. And so just for your planning purposes, that's technically the time that we would usually spend on average. Okay, now there are a few musts that I really need to go over with you prior to having you come in for a face-to-face consultation. And this will be super important so that you can maximize the time that we have set aside for you and that we can spend together. So the first thing is I encourage you, please try to arrive to your appointment 10 minutes ahead of your scheduled time. Now, this is very important because I tend to run fairly on time. Okay, I really pride myself in trying to run on time. I'm usually not very late, and I really want to let you know that I value your time, and I also ask you to value my time and the time of other patients as well. So try to arrive to the appointment 10 minutes ahead of your scheduled time, so that if you don't have any paperwork with you, that you can fill it out, and still we can start your appointment in a reasonable time. If you get a chance, it's helpful if you download and fill out the intake forms prior to your visit. So you can find those on our website. You bring that information to the consultation, and you don't have to take that extra time to fill it out prior to your consultation. Now, I need to let you know that if you arrive late for your appointment, then depending on how late you are, I may not be able to see you, or it may cut off the amount of time that we have together. And I really want to emphasize this because I want to make sure that if you take the time to wait for your consultation appointment, to drive on in, to pay the consultation fee, that you're going to maximize that time that we have together. If you show up late, then your time is going to be cut short because I do tend to run on time, and I don't want the next patient to be to basically pay the price of maybe you coming in late. So we do shorten the time if you show up late. So just to let you know, you got to show up on time so that we can definitely maximize your time together and get all that information that you want to get to determine whether plastic surgery is right for you. Now, if you're going to have revision surgery, okay, so if you're thinking especially about revision breast implant surgery, please bring your previous records with you. Now, I have kind of beat this into the ground in the pre-consultation videos, but if you're having implant revision surgery, bring your old operative records, bring your implant information. You can, if you don't have it yourself, call your previous plastic surgeon to get that, or if they don't have it, call the surgical center to see if they can get it. We can still do the consultation if you don't have it. If you just can't obtain it, we can still do it. It just gives us so much more information that we can work with to plan your operation. If you forget to bring it with you, then we will have to have you come back for a second visit. And I don't want you to waste your time driving all the way back for another appointment if you don't need to. And super important, if you smoke cigarettes, if you smoke hookah, you got to be off smoking prior to your appointment. You have to quit. I do not operate on smokers. It's way too high risk to operate on smokers. And so if you're a smoker, typically you'll have several months before I see you in a face-to-face consultation from after the time you make the appointment. Take that time to stop smoking. Quit smoking. You have to be off cigarettes for at least a month before surgery and a month after surgery. And we do test patients for smoking prior to surgery, and if it comes back positive, we do cancel the operation. So got to get off cigarettes, and it really is for your own good. I just don't want you to have a complication from smoking, and the risks are just way too high. Now, the cost of a consultation fee is $400, and that is taken off the surgeon's fee if you decide to have surgery. Okay, and so the consultation fee is basically for my time, for your time, and to make sure that we maximize that time together. And that fee is once again taken off the fee if you decide to have surgery. If you decide not to have surgery, then the fee is not returned, and unfortunately we don't have any exceptions to that rule. So this is something that I've had in place, a consultation fee, ever since I started my practice, and has been very helpful, I think, to keep things consistent with less no-show appointments and things like that. Well, I hope this has been helpful for you to get you set up for a face-to-face consultation. If after watching the pre-consultation videos you think that plastic surgery is a great option for you, it very well may be, I would love to see you for a face-to-face consultation. The next steps that you'll find here on this pre-consultation course is we will get you all set up for getting that face-to-face consultation and getting that appointment to come see me. I look forward to seeing you in my office. I look forward to seeing what you and I can do together to get you where you want to be. Thank you once again so much for watching these pre-consultation videos. I hope they have been super helpful for you, and I really look forward to meeting you face to face.